Allow me, Mr. President, to transmit you personal greetings from Dr. Margaret Chan, Director General of the World Health Organization, and from Dr. Rul Gama Vaz, the WHO Regional Director for the African region. They wish to have been here today, but due to other prior commitments, they request me to represent them at this Presidential Summit on Universal Health Coverage. Excellencies, during a recent meeting, Dr. Margaret Chan stated that universal health coverage is the single most powerful concept that public health has to offer. The vision of universal health care is rapidly becoming a reality, with access to health care no longer the privilege of a few, but the birthright of all citizens. In fact, countries have recognized the importance of universal health coverage as a way to enhance health, social cohesion, and sustainable human and economic development. Along the way, the primary healthcare principles of Alma-Ata were re-emphasized during the Abuja and Tunis declarations. The re-emphasis underscored the need to look at universal health coverage as the necessary vehicle for the attainment of MDGs and beyond, and to look at health financing reforms together with health system strengthening and factors such as education, gender, social exclusion that traditionally fall outside the health system. It is on this basis that Ministers of Health passed in 2011 in the World Health Assembly resolution committing member states towards universal health coverage. It is well acknowledged that each year over 100 million people in the world are pushed into poverty and another 150 million are left to suffer severe financial hardship just because of the way our health service delivery systems function presently. This acknowledgement dates back to 1978, when the Alma-Ata Declaration on Primary Health Care was made, emphasizing equitable access to appropriate and affordable health care services. In fact, out of pocket, the example is the user fees, levied at a time when people need service, not only inhibit the poor and the disadvantaged from seeking health care, but are also a major cause of impoverishment for many who obtain it. Ladies and gentlemen, there is no universal formula for reaching universal health coverage. Each country must carve its own way forward. Today, it is indeed an honor and privilege to be part of this distinguished gathering that with your leadership, Mr. President, Nigeria is defining its own universal health coverage roadmap, rooted in the country's own culture, political system, and institutions, and the legacy of existing health systems, and above all, the aspirations of all Nigerians. WHO strongly believes that Nigeria can and will achieve universal health coverage. We wish to congratulate the Federal Minister of Health for tangible achievements being realized so far in improving access and quality of health service and health care in Nigeria. However, we are all clear that a lot needs to be urgently done to make this dream a reality. We really appreciate the serious way Nigeria has responded to move health systems toward universal health coverage. This commitment is evident with your own presence, Mr. President, in this summit, but was also evident during the open, rich, and constructive discussions held during the two-day technical meeting for the preparation of this summit. However, universal health coverage in isolation is no guarantee of efficient and effective care. In addition to political will, universal health coverage requires sufficient number of well-trained and motivated staff, with adequate resources for promoting prevention, diagnosis, treatment, and professional development, and to drive a culture of good governance and aspirational attitudes. Your Excellencies, ladies and gentlemen, universal health coverage brings important social dividends as well. In the absence of public spending policies that make equity an explicit objective, economic growth alone will not end the poverty, deprivation, and the misery held. What matters most is the rate at which economic wealth is translated into less poverty, more opportunities, and better health and better education. All of these outcomes requires deliberate policy decisions. Within the context of universal health coverage, there is need to develop validate measures and an independent mechanism, not only to monitor progress, but also to ensure the highest standard of care with the necessary quality as human right, which was proposed by the United Nations in 1948. Ladies and gentlemen, progress towards universal health coverage cannot be achieved by the Federal Minister of Health alone, even in the presence of political commitment at the highest level of the government. It requires a concerted national effort. Also, universal health coverage would not be achieved without full participation of the communities themselves, the civil society, and the private sector, to the progressive realization of universal health coverage to keep promotive, preventive, curative,